Please introduce yourself, state your name, profession, and place of work.
All right, my name is Julie, and I'm a registered licensed dietitian. I work for Integra Hospitals. I work over at the McHenry and the Woodstock campus, and I primarily work in the cardiopulmonary areas as well as heart failure, and I do see some diabetes patients as well.
When did you decide you wanted to pursue this profession?
I've always been interested in food. I've always known I wanted to be a dietitian, so I knew right away in high school, probably by 8th grade, I would say, because I had an older sister. She's 4 years older than me, and she was always super interested in food. She's always going on these crazy diets and stuff, so I got really interested in that right away, so I knew, and I never changed my mind once.
Where did you go to school for this profession?
So to become a dietitian, you've got to do 4 years of undergraduate work. So I did 4 years of undergraduate work at Bradley University, which is in Peoria, kind of downstate Illinois. And I got my degree in nutrition dietetics. I got a BS. And then after that, to be a dietitian, it's required that you do about a 10-month internship. So I did my internship. I went all the way to Nashville, Tennessee to go to Vanderbilt University Medical Center. So I did my internship there. So then after you do the 4 years of undergrad and then the about year internship, then you have to set for your registered dietitian exam. And then once you become a registered dietitian and you pass that test, then you apply for licensure. Not all states require licensure, but Illinois does. So you have to be licensed in the state of Illinois to be a practicing registered dietitian.
Do you have any additional training or certification for this profession?
I worked after school for a few years, but then I went back and I got my master's in nutrition and dietetics at Northern Illinois University in DeKalb. So I have that extra, and then I also have a certification in adult weight management. So I have a specialty certification for people who want to lose weight.
What is your typical day like for you?
Well, I'd have to say I do have a lot of typical days. Most people say they don't ever have a typical day, but I do. I get to work about 7 o'clock, and I check my patient list, kind of see my appointments for the day. Then I'll go into the gyms here and I'll talk to the staff and just see if they have any questions. Sometimes they have communication or questions maybe that patients have asked them to get to me, ask the dietitian this and get back to me. So I'll just kind of touch base with them. I'll do my housekeeping, look at voicemail and email and respond to any questions that I might have. And then right away I just start seeing patients. So I might see, a couple patients a day, or I might see 6 or 7 patients a day. I may have some meetings to go to as well, but that's pretty much a typical day.
What's the worst thing about your job?
The worst thing about my job, this is gonna sound terrible, but it gets frustrating for me for when people come to see me for a certain reason, like maybe they know they need to eat better, like more heart healthy diets, or they want to lose weight or something like that. And they say they're motivated, but then every time we go through something that could help them get to their goal, they come up with excuses. So that's really hard for me, for people who are always giving me excuses. So maybe I'll say, oh, well, we could do this, or we could do that. Oh, no, I can't do that because of this, or I can't do this because of that. So it's like people who kind of want to change, but they don't want to put the time and the effort into it. Like, there's no quick fix with nutrition. Like, fad diets are fad diets. Like, you have to put in good hard work through exercise and healthy eating habits in order to get good results. So it's hard when people make excuses. It's a little frustrating, but that's okay. We get over it. It's not for everybody all the time. Everybody's always at a different level of change, so not everybody's always ready to make changes, even though in their head they want to. They're just not quite there yet. So.
And what's the best part about your job?
Well, my best part then is the opposite. It's when people come to me and they want to change, and then I help them kind of figure it out. So I'll help them say, this is how you eat now, and these are some of the things that you could do differently. And they're like, oh, that's a great idea. I never really thought about that before. And I'm like, yeah, that is a great idea. And then they make those changes and they follow through on those changes, and then those changes lead them to whatever their goal is, whether it's weight loss or lowering their cholesterol levels or not being readmitted to the hospital, or whatever their goal is. that's definitely the best part of my job is when people are super excited and maybe they'll come back, they'll either shoot me an email or call me or something like that in 6 months or a year, and they'll be like, you changed my life. That kind of stuff is what it's all about.
Do you have any experiences that raise the point that's why I do this job?
I think it kind of goes back to the last question. Like, definitely the reason I do this job is because I like to help people. But, when people are smiling and they're happy and, if I can make a positive impact in someone else's life, that's why I do this job. And I have to say, being a dietitian, of course, is always a bonus since you're thinking about becoming a dietitian. It's something that you can always use in your own personal life. So you grow up, you go through college, you're going to have maybe better eating habits than a lot of other people. And with nowadays, chronic disease starts earlier and earlier for people, and childhood obesity starts earlier for people. So if there's any way that you can, get ahead of the game and take care of yourself by having the knowledge to know, kind of what's right and what's not so good, you're going to help yourself live a longer life too. So I think it's a great profession overall because you impact other people as well as yourself.
What is the hardest part of your job, morally and ethically?
When I read that question, I couldn't think of anything. I can't really think of anything that morally or ethically challenges me in my profession. Working in healthcare, of course, we have all the privacy laws. So when someone tells us something, by law, we can't say anything, which is great. I don't want to voice anyone's business, on the street or anything. The only time that we're really allowed to say something that I'm aware of is like if somebody says like that, recently I had someone who said that they felt like their child was abusing their child. So child abuse, we have to report that. So just normal stuff like that. But on day to day, I really can't think of any moral or ethics problems that I face.
What could someone do while in high school if they were interested in your profession?
Well, if you were looking to gain some experience for your resume, because you have to kind of keep in mind when you go to apply for colleges, that's what they look at. So of course your GPA when you get done with high school is really important, but colleges also look at like what kind of experience did you have, like what kind of volunteer activities did you have, were you involved in different groups in your high school and things like that. So I would say anytime that you can get some good resume building experience, whether it's volunteering at a soup kitchen or volunteering just in your neighborhood or something like that, that's definitely something that schools are going to look at. But specifically related to dietetics, I would say volunteering in a hospital, because there's always volunteer work that you're able to do like in the kitchens, or volunteering at a nursing home, especially like in the food service area would be a smart thing to do. Also really working in any kind of food establishments, like if you're a server or even something like a dishwasher or a line cook helper or anything like that that gets you into food service. They do look at that pretty nicely too. Some other good advice I would say is just look into what kind of program you might want to attend with nutrition and dietetics, because not all schools in Illinois offer a nutrition and dietetics program. Only schools that are accredited by, there's a special accrediting body and a regulatory body, the American Nutrition and Dietetics, the Academy of Nutrition and Dietetics, I should say, and they regulate all of the dietitians. So if you're looking for more information, I would definitely recommend that you go onto their website, which is eatright.org, and it'll give you a lot of information. Like if you're a student thinking about becoming a dietitian, it'll tell you all the pathways that you can follow and what schools are accredited and what places also have internships that are accredited. So it gives you a lot of good information that you might not think about, and I'd also do some research like on how many years of school it takes, which we just talked about. But if you're interested like in starting salary and stuff like that, I would probably look that up just so you kind of know what you're looking at. But I would say more importantly above anything about choosing a career, it's make sure that you're doing what you love. because no matter what, the hard days or the easy days, as long as you're doing what you really like and what you really enjoy, it's going to pay off. In the end, you won't have any regrets.
All right. Thank you for your time.
Thank you.